Good afternoon, everybody. Welcome back to the Dr. Harris channel. Today we're going to have a briefing on cytokines. Cytokines are amazingly helpful tools we have within the body. One of the functions of cytokines, they help cells speak to one another. So cell A and cell B can say, "Hello, what are we doing? What's the need? What does the body need? How can we help? What's our job? What's our function?" Cytokines help them speak to each other so that they can help us manage all of our awesome bodies. So that's the job in a nutshell, very loose, very brief, very clean and clear to understand. That's the role of a cytokine. Cytokines have different various groupings, and our briefing will give us the briefings interleukins, TNFs, tumor necrosis factors, apology. We're going to learn all about that in this video, the various kinds. There are 35 groupings of interleukins that are classified under the broad umbrella of cytokines, and not all of the 35 known interleukins are known exactly their precise functioning, because we're still finding out about them. Cytokines are broad in that they impact and affect the response and how we are managing and how we're understanding what's going on with the body, to the body. They help to produce symptoms that indicate, hi, something's going on inside and you need to take a look at this. So we are very grateful for cytokines because they do this. So they will help us have fever to say, hi, we have some type of an infection, come take a look. Might be serious, might not be, but it lets you know there's something happening. They're great with modulating immune responses. Hi, there's inflammation here, let's come check this out. These are the roles that you've seen already produced by the body, the effects of cytokines. So we are grateful for cytokines. So we're going to take a look and see how wonderful they are, how they do their hello moto. The only thing that might not, well, I'm going to give it to you now. Cytokines sometimes get confused with hormones, only because cytokines they have the ability to impact the cells that they are made from, and they also have the ability to impact the system of the body, an organ system, a tissue system. They are able to do that. And that's how they're created. They're wonderful, they're awesome, and they are used to help us in many different forms and fashions. So we're going to take a look at and give a brief rundown of the awesome, amazing attributes that cytokines bring to us, to our cells, and how they help us pay attention to the things that we don't always see, like our beautiful faces and our skin, and you understand. All right, so let's get to it. And again, if you have any questions, make sure you reach out on YouTube or at Dr.Claudia.Harris@gmail.com, Dr.Claudia.Harris@gmail.com. Enjoy.
Cytokines are small secreted proteins, which mediate and regulate immunity, inflammation, and hematopoiesis. Hematopoiesis is the production of all types of blood cells. The communication among immune cells, within the immune system, is mediated by these cytokines. Cytokines bind to specific receptors on the surface of other cells, known as cytokine receptors. Once these cytokines bind to specific receptors, it generates an internal signal. This signal alters the activity of the cell. These cytokines generally do some main functions such as development of cellular and humoral immune responses, induction of the inflammatory response, regulation of hematopoiesis, control of cellular proliferation, differentiation, and induction of reparative processes. Cytokines induce their effects on many different cell types, via autocrine, paracrine, or endocrine mechanisms. In autocrine action, cytokines act on the same cell. So, it is a self-activation. Paracrine means cytokines act on neighbor cell. Endocrine means once a cell release cytokines, it transport through our circulation and reaches to distant target cell and acts on it. The important cytokines, which are involved in signaling between the cells of the immune system, are interleukins, tumor necrosis factor, interferons, colony-stimulating factors, chemokines. Interleukins are a group of cytokines, which are mainly produced by T helper lymphocytes, as well as through monocytes, macrophages, and endothelial cells. Monocytes are a type of white blood cells, which can differentiate into macrophages. Macrophage is a type of white blood cell that engulfs and digests cellular debris and microbes. Endothelial cell is a type of epithelial cell that lines blood vessels and lymph vessels. There are about 35 interleukins identified. They have been numbered in the order they were found. Here are some of the cytokines listed in numerical order, stating some of the things they are known for. Interleukin 1. Interleukin 1 is released by macrophages and monocytes in an early immune system response. It stimulates T-cell proliferation and protein synthesis. Interleukin 1 causes fever. Interleukin 2. The main function of interleukin 2 is to promote the development of T regulatory cells. Interleukin 2 purpose, pro-inflammatory and antigen-specific adaptive immunity. Interleukin 4. Interleukin 4 purpose, supports learning, memory and higher function in the normal brain. Interleukin 4 also promotes anti-inflammatory action. Interleukin 6. Interleukin 6, mainly secreted by T helper cells and macrophages. It promotes the production of acute phase proteins in the liver, such as C-reactive proteins, serum amyloid proteins, fibrinogens, and mannose-binding lectin proteins. Acute phase proteins play a role in mediating such systemic effects as fever, leukocytosis, increased cortisol, decreased serum iron, and many others. Interleukin 8. Interleukin 8 is mainly produced by macrophages. It induces chemotaxis in target cells, which is the movement of a cell or a part of it, in response to a chemical stimulus, and induces phagocytosis once they have arrived. Interleukin 10. Interleukin 10 purpose, anti-inflammatory action, limits the pathogen immune response and prevents damage to the host. Loss of interleukin 10 results in development of inflammatory bowel disease. Interleukin 12. Interleukin 12 is produced by macrophages and dendritic cells. They stimulate production of interferon gamma, which is a cytokine important in allergic responses, and induces differentiation of T helper cells into T helper 1 cells, which can stimulate the growth and function of T cells. Interleukin 12 purpose, pro-inflammatory, bridges innate resistance and antigen-specific adaptive immunity.
Okay, so before we get into the video portion where it's explaining, before you read and you're listening to what TNF does, tumor necrosis factor does. A portion of what tumor necrosis of TNF does is mediate the death of cells, right? The cells will be thanks to TNF, will be say, okay, it's your time to move on. It's your time to die, and the new cells will then come and sit in its place. This is a part, the needful part, the healthy part of the body doing that which it is supposed to do so it can function properly, so that we function properly. And it's needful. I would not like anyone to get up in arms and say, oh my gosh, cell death, that's bad, because it's not. It's purposely put together to maintain the optimal health of a normal body without malady. Okay? For example, blood cells. White blood cells will have a shorter lifespan than do the red blood cells, right? Red blood cells carry the oxygen throughout the body, and their lifespan typically is 120 days. White blood cells, their function in the body is to help fight off germs, viruses, bacteria, parasites, that sort of thing. They have a shorter life. Some 3 days. If you're a T cell, you have 1 or 2 days, or you can even go for a week as a T cell. You could even go for a week, for months, depending on what it is that you're dealing with, what the foreign substance is, and what's the battle like in the body. So these things play a role. So the work of the cell will determine the length of time that cell has before TNF, before tumor necrosis factor says, okay, you're phased out and we have new cells to come and take the place. So now they're ready and they're renewed and they're at the top of their game to do the job, to do the purposeful function that the body is needing. All right, so just so understanding that this is the balance that is needful and not to get scared by that, okay? All right then, continue.
Tumor necrosis factor. Tumor necrosis factor is a group of cytokines involved in systemic inflammation and can cause cell death. Tumor necrosis factor interacts with tumor cells to trigger cytolysis or cell death. Tumor necrosis factor is produced chiefly by macrophages. In inflammation, this tumor necrosis factor binds to neutrophils and induce inflammation.
All right, so let's just talk about this inflammation. I know inflammation gets a very bad rap. People hear inflammation and freak out. Ah, inflammation. I get it, okay? Hold on. Remember, there's a balance. There's a good and a negative to everything. One thing has two sides always. In life, in biology, with the cells, it's the same thing. So let's get to it. Inflammation in and of itself is not a negative, is not a drawback. Inflammation has its place. Chronic, meaning long-standing, habitual inflammation, yes, no good. Inflammation, acute, meaning right now happening, I sprained my ankle, I tripped, I fell, I have a fever, something bit me. Things in those categories have benefits to the body. Speak health. What, Dr. Harris? Yes. Speak health to the system. Okay? Let's not get crazy and look to generalize and miss the pointed efforts of benefit that inflammation brings when it shows up. All right? So inflammation in its right now situation and right away situations, right? Like for an insect bite, and you get this localization of pain, and you get the swelling or wherever, you get the bite, This is okay. This is yay. My body's working to make sure that I'm okay. It's looking at ways to try and get the toxins from whatever stung me that's not supposed to be there out. Local, get it in one space and then break it down so that it's of no effect to me, on me. Of course, there are some people who have allergic reactions, and that works in the same way. It's a trumpet call, like, ring the alarm. You understand? It's like, let's go. We have a problem. We have a situation in aisle 3. We have a clean mess in aisle 4. Clean up. This is that. This is that exactly for cells. So that's a plus, right? Because you would not like the thing to then spread. It encapsulates. The inflammation causes for a containment, if you will, of this foreign object that's been placed into the body via whatever the bee, whatever the insect, whatever the mosquito, whatever the bug was that bit you, and helps to protect that area. And then the fluid that rushes to the bite, with the site of where the bite happened, spider bite, whatever, works to dilute whatever was put into the dermis, into the skin, I apologize, into the skin, right? And breaks down and looks to break down those toxins. Okay, next time where we have inflammation is yay! I am in this category because I seem to, no, not now, thank God, sprain my ankle. So in those cases where the ankle is sprained, it hurts, blah, 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 it's uncomfortable, yes, but what the inflammation is actually doing is forming something of a cast, if you will, to allow for prevention of further injury. It's saying, okay, I see you just messed that up. Let's make sure you don't do anything else creative and mess us up all together and take us down. Let's get you not to move this ankle, in this case as the example. This is my example for and let's tighten that up. So that now we give it a chance to what? To not be aggravated, to get a chance to heal and get you back in a wonderful place where you were able. And this is not an issue that we need to deal with again. So this is good. Even when it's severe, and I've had some really severe sprains of the ankle, 5-inch heels, 6-inch heels, flats, playing in wedges, soccer, when who does that? But, you know, even with severe swelling, it will go down. It will stop you from putting weight to prevent any further damage to an already hurt situation and get you back on your feet. Fever, mothers, fathers, grandparents, godmommies, aunties who take care of children hate fevers. Having a fever ourselves, we don't like it. However, it is a whole body inflammation that works to kill off whatever infections are within the body. The body says, all right, we have an unknown. It's not supposed to be there. The interleukins that we heard about before then allow for it. I believe we already touched on that interleukin. We already met the interleukin that is responsible for our ability to have fever and rings the alarm and says, hey, everybody, we have something here. We need to check this out. We need to raise our temp. We need to heat this sucker up and kill it. Sometimes it works. That's the purpose of a fever. So when you've gone to the pediatrician, they said, oh, the child is fine. How are they behaving? Are they acting like themselves, a little cranky, blah, blah, blah. A little rest, but they're okay. You know, they're still talking and they're normal selves. Their temperament's still the same. It's all right. Just the high fevers need to be brought down. But still, even with that, it's a byproduct of the interleukin saying, hi. The white blood cells say, hey, we need some assistance in this area. And your body's internal temperature raises in the attempts to kill off the invader, because it'll be uncomfortable and the temperature has risen, and that'll disturb its equilibrium. It'll disturb its chemical constitution, and it heats stuff up so that it's not able to reproduce and use the uninfected cells and get them infected. So it has its place. You understand? I hope you're getting the hang of it. Or you cut yourself, a paper cut, not looking what you're doing while cooking, if you still shave, any cut. You cut yourself. What happens here? Your blood brings in the pro-inflammatory ILs. Interleukins. Sorry. Remember, clear understanding. So interleukins. Also, as we've demonstrated, it's IL. So it really shouldn't be a problem if I say IL, but I clarified. This is also good. This is where inflammation is a plus as well. It's needful, it's healthy, it allows the body's blood flow to come up to that area to jumpstart the healing process. Okay, let's press that out. Let's get whatever that was that just opened us up, whatever that was, get that blood out, boom, and let's start healing. Let's get that rejuvenation in. Let's get this healed up now. You understand it helps to repair the wounded area. It initiates the blood clotting because now you're bloodletting, right? Meaning that blood is outpouring. So it stops that and allows for the swelling to kind of do a similar situation, kind of like creates a cast around the area. Something similar to the example where I gave you with the sprained ankle or spraining the ankle. It's the same. It is in the thank you, is in the similar vein. And, that helps with also looking for if there is an infection or anything like that. That is purposefully done to help support the body in wellness. What else? Another plus that we might be overlooking, the benefit of inflammation. If you have ingested something that's, what should I say? What's a nice word for this? If it's not completely fresh, if it's old or rotten or molding and you weren't paying attention, if you're exposed to something, whether it be a food substance, whether if you're exposed to anything that's toxic, right? Virus, bacteria, food ingestion, anything like that. Inflammation will come as a ring the alarm to get everybody that's responsible for fighting up in arms to try and constrict and contain the problem as your body looks to work it out. And that's why inflammation is a plus. Not a hindrance, not a, oh no! It is a thank you so much, body, for doing what we need you to do. Thank you so much, body, for being available to help and to bring health into our situation, to help us to regain strength. This is that, okay? Very good.
Interferons. Interferons are proteins released by T helper lymphocytes, monocytes, macrophages, and endothelial cells, in response to pathogens such as viruses, bacteria, or parasites. Interferons have been classified into two major types. Interferon type 1. It include interferon alpha and interferon beta. Interferon type 1 is produced as a response to a viral infection. These interferons bind to nearby uninfected cells. Then uninfected cells produce antiviral proteins, which inhibit the viral protein synthesis of the cell. Interferon type 2. It include interferon gamma. An interferon type 2 increases the phagocytosis of macrophages. Colony-stimulating factor. Colony-stimulating factor is a cytokine which can cause the cells to proliferate and differentiate into specific kind of cells, mainly white blood cells, in response to infection. Colony-stimulating factor stimulates stem cell to divide. Stem cell gives rise to new immune cells. New immune cells continue to grow and form an army to attack the infection. Colony-stimulating factors include macrophage colony-stimulating factor and granulocyte macrophage colony-stimulating factor. Macrophage colony-stimulating factor also known as colony-stimulating factor 1. It influences hematopoietic stem cells to differentiate into macrophages and monocytes. It affects macrophages and monocytes by stimulating phagocytic and chemotactic activity. Granulocyte macrophage colony-stimulating factor, also known as GM-CSF. It is secreted by macrophages and T cells. It controls the production, differentiation, and function of granulocytes and macrophages, and it also controls dendritic cell and T cell function. Chemokines. Chemokines control the movement of immune cells. For example, the presence of a microbe or a foreign body triggers the release of chemicals that then direct immune cells to migrate towards the site of infection. Cytokines are crucial for fighting off infections and, in other immune responses. However, they can become pathological in inflammation, trauma, and sepsis. Inflammation, trauma, and sepsis activate excessive production of pro-inflammatory cytokines, including tumor necrosis factors, interleukins, and cytokine receptor blockers. The excessive production of these pro-inflammatory cytokines causes capillary leakage, tissue injury, and lethal organ failure. Interleukin receptor blockers competitively bind to the interleukin receptors and inhibit the actions of interleukins. For an example, interleukin 10 is an anti-inflammatory cytokine. Interleukin 10 receptor blockers competitively bind to the interleukin 10 receptors and inhibit their action.
All right, so I hope this was helpful. I hope if you have any questions, you'll know what to do. The email is going to show up in one of these slides, the ending slide actually. So that'll be there for you. Of course, you just can ask the question on the channel and I will see it as well. So thanks for watching. Watch as often as you need to help you understand the benefits, the classes of cytokines, and use your information, share the information, subscribe to the channel if you haven't already. Be well until the next time.